Okay, good morning. Good morning. Today we're going to deal with a lot of conditions. And these conditions that we're dealing with are important. As everybody knows, today we're going to talk about endocrine conditions and what else? GIT disturbances, right? So apparently we need to understand that particularly endocrine disorders, diabetes mellitus is a very common problem here in the United States and in the world, and therefore it's important that we deal with this problem. As I always emphasized before, when you're dealing with a particular disease process, first things first, you need to know what organ is involved, right? And secondly, you need to know what is the pathogenesis, what created the problem in this particular case. In patients suffering from diabetes mellitus, what organ is involved? Pancreas. Which part of the pancreas is involved? Which part? The beta cells of what? Okay, the islets of Langerhans, right? The islets of Langerhans is the endocrine component of the pancreas. We know that the pancreas is important because of two things. It's an exocrine function, is to release what? Pancreatic enzymes for chemical digestion because of these enzymes necessary for breaking down the food in the duodenum, right? That's where the pancreatic ducts will be releasing these enzymes. Great? And to be sure. Okay. At the same time, we also need to understand that the pancreas also has an endocrine component which happens with the islets of Langerhans, which does not have any ducts. Therefore, the hormones produced there are released directly where? Into the bloodstream or blood circulation to be able to reach their target organs, right? Okay. The alpha cell, what does the alpha cell secrete? Okay, glucagon. What about the beta cell? What is the hormone? Okay, what about the delta cells? Somatostatin. Is there any other cell? Do you know of any other cell that is found in the pancreas? What is it? What letter would it be? You remember? F cell. Who said F cell? You're the woman, okay? I would already hire you for that question only, okay? Okay, so F cell, what does the F cell secrete? Huh?
Pancreatic polypeptides.
Yeah, polypeptides, the pancreatic polypeptides, which are important too. But the bottom line is that in diabetes, the main problem lies with what? Insulin released by the beta cells, right? Now, if you remember, if you took anatomy and physiology with me before, what is the role of insulin in our body? What does it do? What does it do in the bloodstream? What does it do? What? Decrease glucose level. Okay. In other words, it's supposed to lower what? The blood glucose levels when it is elevated, right? Okay. So let's try to review very basic concepts here involved here. Let's pretend this is the cell. It's the cell. And what is found inside the smallest blood vessel that is found beside any cell that you have in your body? The smallest blood vessel. Perfect, capillaries. So why do we call them tissue capillaries? Because they are surrounding what? Tissues made up of cells. Now remember, when you eat, okay, this is your nose, this is your mouth. Food goes into what? The mouth. You chew the food, it goes to the swallow, into the esophagus, and then goes where? When it's in the diaphragm, you have the stomach here, right? Okay. And in the stomach, the food is undergoing what? Mechanical digestion because of the churning action of the muscles there. And then once it reaches the duodenum, what does the pancreas do? Release enzymes. Okay? And what happens in the small intestine, particularly the duodenum, jejunum, and ileum, whatever food you eat is already very broken down into very small pieces. It now goes into the wall. What is found in the wall? Blood vessels. And what is found inside the blood vessel? Blood. So whatever you eat, therefore, goes into the blood circulation. Is that what we mean by the word absorption? Yes. Yes, it is, right? So whatever food you eat, every time you eat, and the food contains G for what? What does G stand for? Glucose. The glucose goes where? Into the blood. That's the reason why. Let's pretend this is your 60 to 120, or some would use 115 levels of sugar. Let's say you had meal at 6 a.m. in the morning. The meal contains sugar or glucose. Upon ingestion of this food that contains sugar, what is it will happen to your blood sugar level? Will it go beyond 120? Can even go as high as 200, 250. Once it is detected by the body, what will the pancreas do to the beta cells? Release what? So this is the beta cell of the pancreas, releasing what hormone? I. And what is I? What is I? Now, if you remember, if you were a former student of mine, I compared insulin to what? Okay, to open the door. Okay? So, the I, is there a door? Let's pretend there is a door. Where is the door found? In the cell membrane. These are the receptors for insulin, right? 1 door, 2 doors, 3 doors, 1, 2, 3, 1, 2, 3. How many keys do I need to open 9 doors at the same time? 9 keys, right? Amazing. How many keys? 9. But it should be the same key. What is the name of that key? Insulin is the name of that key, okay? Manufactured by J. Gamo Industries. There you go. It says here insulin, manufactured by J. Gamo Industries. So, how many insulin will I really need? 9, okay? So the insulin, each one of them will go to a particular door and open the door. And once the door is open, the eye will have to attach. Now notice what is found here on the key is a groove. That groove should match what? The key, doorknob, okay? So it opens the door, who goes inside the cell? Who goes inside the cell? Now why does the cell need glucose? Okay, it is going to be the raw material needed in the formation of pyruvate in the Krebs citric acid cycle. Remember chemistry? Which will go into what? Oxidative phosphorylation, which means it needs oxygen where? In the mitochondria to produce what? ATP. In order to produce ATP, do you need glucose? Yes. Do you need proteins, carbohydrates, fats? Yes. Do you need your oxygen? Yes. Oxygen. Oxidative phosphorylation where? In the mitochondria. Now, so glucose is important. Right? So, what happens if there is no key? Then you open the door. Can glucose go inside? That means glucose will remain high or high? Very high. So if you do not have the key, the glucose levels remains high, and that is called hyper what? What is it called? Hyperglycemia. Right? So in other words, it's very simple. No glucose, no key, no opening of the door, glucose cannot enter, right? So let's pretend, let's move this camera there. Let's pretend this is what? This entire room is a cell, right? Right? What is found in the wall? The cell membrane, correct? Okay, what happens now is this. When you look at the door there, what does that door represent? Huh? It's a doorknob, the receptor, right? My name is Dr. G. What does G stand for? Glucose, not Gamo, okay? That's how I'm not sweet, okay? Dr. Gamo for glucose, glucose means sweet, okay? So this is the cell, this is the doorknob. In order to open this door, what do I need? The number 14 key. Number 14 is insulin, right? See? This door can be opened by this key. So don't get this key, okay? So, I need to use this key to open what? The door, right? Okay. At the door, glucose entered what? The cell. Who am I? Dr. G, G for glucose. Now, what happens if there is no key? Can I open the door? Can I go inside?
No, you're stuck outside.
So this is the plasma here. I remain where? In the blood. I cannot go inside, right? Therefore, what happens now is that there is hyper what? Okay. What is the reason why the blood sugar is high? It's because of the fact that there is no what? No key, right? So without the key, therefore, you won't be able to open the door, and therefore, without you being able to open the door, guess what? The glucose remains where? Inside the cell, right? Do you understand? the bottom line, therefore, there's nothing that you cannot answer in your nursing board exam. What do you think Dr. Gamo will tell the nurses to inject the patient with?
Insulin.
Oh my gosh. You know what? You can actually get a perfect score in a nursing board exam. What score? Perfect. No mistakes. If you just know your what? Anatomy and physiology. Because if you know what's normal,
You know what's
oh my gosh, you will know what's abnormal, right? So the patient who's diabetic, they lack insulin, you give insulin, right? As simple as that. The question now is, where do we get to inject this insulin? What is the method to use here? Is it intravenous? Is it intramuscular or sub-Q? And what does sub-Q mean? Subcutaneous. If you remember the skin layer, epidermis, dermis, and what's the third layer? Is the hypodermis or subcutaneous layer part of the skin? Technically, no, right? But what is in the subcutaneous layer that's very important? Is it the adipose or the blood vessels? There you go. You see, Ms. Romero?
Yes.
The answer is not adipose. I don't care about my adipose here. What do I care about? Why do we not the blood vessels? Ms. Lori?
That's where the glucose is at and the insulin.
Of course, that's where you want the insulin to go to the what? The blood, so that it can act upon the cell. Does that make sense to you? So I'm not after the fat. I have so much fat. What I'm concerned about is what? And what is inside the blood vessel, my dear students? Oh, of course. See, don't you love anatomy? Anatomy is so beautifully beautiful and simple, right? So, now, where is the best location for injecting this insulin? As a nurse, I tell the nurse, inject insulin. Where is the best site? Anyone who knows? Yes? Where? Where? Huh? Behind the leg? Okay, somebody said where? Where in the abdomen? The abdominal wall. Okay, somebody said before stomach. I said, no, stomach is deep inside, you know. So you come away with a precise answer. I know what she meant by stomach. Stomach is abdominal wall, but stomach is deep inside. Can you imagine injecting the needle all the way there? So the correct answer is abdominal wall, not even just abdomen, you know. Abdominal what? Okay, why the abdominal wall, Miss Karen Ong?